What sort of lab testing do I do? Well, I can perform conventional testing, and I do that whenever necessary. It is in about 50% of cases. Mostly, I perform specialized lab testing. This is through labs such as Genova Diagnostics, Great Plains Laboratory, and a few others. This testing is more specific and typically finds these subclinical things that we don't necessarily see blatantly showing up in a blood result. So for example, we look at the stool if we're trying to figure out what's going on with the microbiome, if we're looking for parasites or other sorts of infection. We can also look at the urine and test metabolites to see if we're producing enough neurotransmitters, if we're deficient in certain vitamins and minerals. We can look at hair if we're testing toxicity of heavy metals. We can look at saliva for looking at hormones. We can also use saliva to look at genetic profiles and determine if there's a genetic reason why this condition is taking place. So those labs are very important in guiding the form of treatment that I do. Those labs can be supplemented by some insurance companies. Typically, the way it works is payment is collected up front, and if you have insurance, then the lab often works with insurance on the back end to try to collect, and sometimes they come back and ask you for a little bit more to help out. If you don't have insurance, there's a different cash pay price that you can pay. My goal is to be conservative with my patients and offer the least expensive form of lab testing available that will still get us the results that we need.